In this video, let's talk about the difference between clinical depression and situational depression. Let me use two real-life examples to explain the differences. Tom is in his 40s. He broke his leg in an accident. Because of the severe pain, he couldn't sleep at night and soon developed symptoms of depression. After his leg healed, however, his depression did not get better. He even started having suicidal thoughts. After talking to him, I learned that the very first time he experienced clinical depression was at the age of 16. It was treated effectively with medication, however, he did not continue taking them until this relapse. During his hospitalization, the doctor tried many medications on him and they failed to show their effectiveness. Finally, they decided to use ECT, electrical convulsive therapy. After the seventh treatment, one day he called me and said that he felt happy for the first time in a very long time. He continued to take medication after discharge. Now he's able to return to work and his condition is stable. Jenny is in her 60s. She is someone who is always positive and happy. However, over the pandemic, she learned that her dad passed away in her native country and she couldn't go back to attend his funeral. Because of that, she developed depression. The quality of her sleep was poor, she lost interest in everything. However, with the help of her family and her church people, after 3 months, her symptoms started to improve. Eventually, without any intervention from the doctors or therapist, she recovered on her own. Let's analyze the differences between the two cases. Tom has clinical depression. It's a mental illness. Depression and suicidal thoughts were triggered by the fact that his brain was sick. Most people have mental illness are born with a genetic predisposition. When life gets a little tougher, something very trivial can lead to a full-blown episode. The typical age of onset is between 18 to 24. However, it appears to be that more and more people as young as 12 to 13 are reporting feeling suicidal. After giving birth or during menopause are also life stages where women are likely to have another episode. It always happens when the body is going through major changes or our health in general is bad. When our overall health declines, our brain can also get sick at the same time. Technically, Jenny did not have a mental illness. Her poor brain health is only a temporary mental state. In this case, everyone has the potential of experiencing situational depression because we cannot avoid tragedies from happening in our lives. The difference in the severity of symptoms. When I had my first episode of depression, I experienced severe insomnia along with many physiological symptoms. My heart was beating fast, I had an extreme phobic feeling, and my headache felt like a volcano ready to blow up. After 2 weeks without sleep, I couldn't control my suicidal thoughts 24/7. I had different plans formulating in my head. It's like when someone is missing in the desert for a few days, all they can think about is water and food. Clinical depression is an illness with the brain. The patient is unable to use willpower to overcome their suicidal impulses. When clinical depression is left untreated, it would debilitate every aspect of brain function. During my latter days, I couldn't even feel if I wanted to go to the bathroom. In 2006, I was once again depressed. However, I had already been taking psychiatric medication for 3 years. I found that depression felt different this time. First of all, I was able to sleep every night, even though the quality of my sleep was not good. Secondly, I did not have any physiological symptoms. And lastly, I had a good reason to be depressed. I was tormented by the fact that my suicide attempt had left me permanently paralyzed. Even though I thought about suicide, deep inside I knew that I was afraid to die. Therefore, if a person is depressed because of situational factors, for example, not being able to pay back the enormous debts that he owns, the moment he jumps off the cliff, he did not actually want to die. In terms of treatment, unlike situational depression, most people can recover by taking a vacation, seeing a therapist, or being cured spontaneously by the passing of time. If someone is clinically depressed because they have a mental illness, the only effective way to help them is to take them to a psychiatrist or admit them to the psychiatric ward. The focus is placed on treating their brain and organ. Medical intervention is the first step in recovery, like how we treat every other illness in the body. The focus should not be placed on how to solve their problems in life. In Tom's case, the trigger of his depression is no longer relevant after his leg has healed. It's impossible to use talk therapy to alleviate those physiological symptoms that I described. Before a patient's brain achieves some levels of recovery, it's useless to spend a lot of money on seeing a therapist. You can purchase a hard copy of my book Leap on all platforms that sell books, or you can download a free PDF from my website, nancysha.com. Thank you so much for watching this video. Please consider share and subscribe.